So welcome everyone to this info session for the Co-Priority Survey Working Group, which we are just in the process of launching. And I've set the scene. I think it was hopefully made clear that this is a survey that we're wanting to produce in collaboration between the Community Knowledge Matters Network and also with Professor Sarah Ann Muniz, who's with us today and is going to be kind of co-facilitating this through her role based at UHI. So just to give an overview of what we'll be covering today, so we'll give a little bit of background and context, both in terms of what this network is. Lewis has given a little bit of a flavour, but we'll kind of go into a little bit more detail, but also what the kind of background and context is for the co-priority survey. And how that kind of fits into some of the wider work. We'll look at who we're looking for in particular for this working group, and then also what being involved in the working group might involve, and kind of some of the kind of overview of the kind of commitments and schedules and ways to shape it. And then look a little bit about the next steps, what the kind of application process is, and then of course there'll be a chance for Q&A at the end as well. So I guess Lewis has kind of started to frame it a little bit, but so the Community Knowledge Matters Network came out of the Ideas Fund kind of partnerships across the Highlands and Islands to look more broadly at how we can take the learning from those community researcher partnerships to try and kind of create more systemic change. And so looking in particular around the kind of infrastructure and the kind of structures that affect community researcher partnerships and how we can make them more equitable and more community-led. So one of the kind of, there's a few of the kind of overarching questions on this slide here, but one of those questions is kind of thinking about what types of evidence counts or gets listened to or is valued and how we can change that. So, you know, for one example, how we can allow lived experience or kind of community knowledge, Indigenous knowledge to help influence policy change in different ways. And so we've got a kind of wider set of network aims that I'll come to in a little bit to kind of show that kind of larger kind of almost campaign element to this network as a whole. We've been running as a network since the summer, and one of the first things that we did was collectively as a network work on some of our network beliefs and kind of values. And so I've got the network beliefs up here on the screen, and I think that hopefully gets to the heart of what this network is trying to do, but also what we're specifically wanting to do with this co-priority survey. So, you know, the first one is acknowledging that we need diverse and integrated forms of knowledge to make sense of the world. And that everyone's expertise matters. You know, there's often a kind of assumption that you know, experts are kind of held in a university context, but very much wanting to look at those other forms of expertise, whether that's by experience or, you know, other forms of insight. Also an acknowledgement that research is never neutral, that there are always underlying values and ethical and political tensions that we need to navigate. So thinking about, I suppose, the kind of power dynamics that exist around community researcher partnerships and how we can kind of try and change that or kind of affect those dynamics in different ways. And again, the survey in some ways is trying to kind of address some of that. And yeah, I kind of believe that we're better working together and sharing resources to affect structural change, and that researchers are not themselves separate from communities. So, you know, for those who've come into some of our regular communities of practice, we have a kind of community check-in where we acknowledge that, you know, everyone kind of wears different hats, and no one person is, you know, necessarily just a researcher or just a member of their community. Of course, researchers are part of their communities and maybe come in with their own lived experience in their own right, but also that community members are also researchers in their own way, and have just as much to kind of contribute and value that. So I'll maybe pass to Lewis to just kind of talk a little bit about the kind of wider aims of the Community Knowledge Matters Network and where this co-priority setting survey fits into that.
Thanks very much, Lauren. And I just off the back of that, actually, one of the things that we've introduced in some of our other community practices, for example, the network, is just recognizing the language. And actually, again, sometimes this comes with different words. And actually, I've simplified in the next slide some of this. But one of the things I just want to introduce at this point, and even if people are listening in on the recording, is that we've got a Padlet link which I've just introduced as well. So if there's any questions that you have, if there are any terminology that you're not quite sure of, obviously feel free to ask. But also we have got a Padlet, which is kind of an online board, and in which case, if you prefer to ask anonymously, it's a place to do so. And also that will be for any questions as well. Hopefully we'll be able to answer some of the questions through this wee presentation, but I just wanted to put that into the chat as well, just in case we're already starting to say words, which actually we need to spend a bit of time defining, which would be obviously grand. What we showed you before is a earlier version of, and we've just tried to simplify it just for the sake of communication, in terms of what the kind of aims of the network and what we're hoping to do. And so Community Knowledge Matters was, even the name itself was through the stakeholder conversations, it developed through that process. And there are kind of 4 key areas that we're hoping to do in terms of this work. So of course, one is building this wider network, and that includes both those that have been involved in the Ideas Fund, but out with the Ideas Fund too, in terms of building this wider coalition and collective. And there's certainly a lot of work that's going on that we acknowledge, both within the Highlands Islands and Scotland in general, which is moving this type of work in this direction. So the type of work that SCDC, for example, Scottish Community Development Centre, for example, are doing about action research. And so really acknowledging that and trying to work collaboratively to kind of think about how we could work as a greater sum of our parts, but also offer opportunities for communities, researchers, everyone in between in that spectrum within the Highlands Islands and otherwise to connect. So and build those relationships that are so fundamental in this type of work that is meaningful. And so we run monthly open community practices, for example. We also have what was really important was working out, and this will fit, is the most specific work package, as it were, is this co-priority setting. So working groups that, again, even through things like the Ideas Fund, we've not necessarily been able to reach. And so one element of that is that this research co-priority survey and working group that's developing, and that is obviously working very closely with Sarah Ann, who will set a bit of context as well from UHI. But also something that's evolved, well, it wasn't initially one of our plans, was this kind of participatory ethics working group. So this idea around what type of work and how should we do this type of work in ways that are ethical, which don't, and within an institution, within research setting, very often that means a very specific thing and very often a very rigid thing. And sometimes it's about how we can be pragmatic and balance that, but also maybe reimagine where very often, perhaps it's fair to say, those ethics processes are not necessarily centering the needs of communities themselves. And so how could we do this in different work? And we're working with partners, particularly up in Shetland, including with Shannon, who's on the call today, for this type of work. The last 2 I'll just mention very briefly, but just for context, we've got this collective capacity building. And so one of the outcomes, hopefully, of the co-priority survey is to kind of really help frame what training is needed, what support is needed in terms of and what people would like the network to be able to do. And obviously that we'll be able to resource that in terms of developing websites, collating resources together. But one thing that's been really important, and Lauren has really been leading, and this come very strongly through some of the work we've been working with the health and social care group, is just acknowledging that this type of work has been done before. Many communities are over consulted and have a lot of consultation fatigue as well. And so a big key part of this work is also acknowledging that and doing a lot of that mapping. So we're not asking questions that have been asked of communities a lot of time over. So really trying to build that evidence base over. And then, of course, the wider piece of work that's is going to fit in all this is that kind of systems and policy change. That's the really key thing. If there's no more funding for this type of work, what can we change in the landscape, even in a small way, that would actually enable communities and research, community-led research to happen in much more kind of equitable, dynamic, ethical ways that can actually affect policy as well. And so, and I guess the last thing I'll mention about that is not just about changing, and very much not about changing necessarily what communities deem as important, but maybe it's about changing how policymakers what they deem as evidence and objective, for example. So yeah, hopefully that sets the scene a wee bit. I just want to also acknowledge that we've got a steering group for this type of work that involves open. Well, you can read them all below, but including Murray Wellbeing Hub, UHI, and Public Health Scotland, and I know Caroline's on this call as well, with members as well. So there is a steering group that this will all feed into as well. So it will hopefully trying to build all this very ambitious work together into a coherent whole. And our job as Science Kaylee is to not quite be the official secretariat, but is to hold and support this work and coordinate this work, because we appreciate that capacity can be very challenging. Yeah.
Great, thanks, Lewis. And so, yeah, that kind of sets the context of how it fits into the wider Community Knowledge and Matters network. And as I said at the beginning of this call, we're also working very closely with Professor Sarah Ann Muniz, who's also, in her own right in the steering group, but also is involved in this wider piece of work that kind of sits into an international context. So I thought maybe we can just pass over to yourself, Sarah Ann, if you'd like to give a bit more of a background about the co-priority survey itself.
Yeah, of course. Thanks very much. Yeah, it's great to be involved in this work. I think it fits with at least two priorities in terms of what we're carrying out through the Community Knowledge Matters and UHI more widely, which is involving researchers and communities working together to think about how research itself is conducted, and also about what types of topics and areas we feel should be prioritized for rural mental health research. So I think this can form a really important part of that work. As Lauren said, the context for the co-priority setting from the research side links with a group of international researchers that I've linked with, who are all interested in rural mental health. There's also practitioners within that group as well. And through that discussion, we realised there are some very similar questions that we've been asking across the different countries around these areas about how do we engage with rural communities, what are rural communities' own priorities, etc. So Professor Russell Roberts in Australia suggested we could collaborate towards producing a position paper for rural mental health research. So that would really be a kind of short statement of intent around how rural mental health research could be taken forward in a collaborative way, and in a way that kind of answers some of these questions that seem to be common between rural areas in different countries. So we're contributing from the Scottish side, so we will be contributing the Scottish context to that paper, and it really needs to be a collaborative piece of work. So really happy that the network can help facilitate that, and together hopefully we can produce evidence from Scotland that's helpful for ourselves and also helpful internationally. We'll be looking to highlight the Scottish work within the launch at the Rural Mental Health Leadership Conference next year in the summer. I think we could have the next slide. Thanks. So, Lewis, thank you. So this was just to give you the overall aims for the group and the paper that would be emerging. So we're trying to serve as a guide for, particularly for new and emerging rural mental health researchers. We would see it as a resource to influence funders and governments, particularly around setting project standards, guidelines, timelines, and linking to funding. We'd be aiming to give voice to rural residents and what constitutes ethical research around rural mental health, and to advocate for fair and equitable funding for rural mental health research. Let's have the next slide, thanks. So just to confirm what we've kind of outlined, I think in the materials previously, we really would love community members to be involved, and that could be if you're representing a community organisation or simply as an individual, but we're asking that you'd be based somewhere in the Highlands Islands, and you definitely don't need to have done anything like this before to take part. Just need to bring your own enthusiasm and thoughts really to the process, because there will be a lot of support and facilitation as much as is required. And yeah, look forward to taking any questions or points later on. Thanks.
I can just feed into, thanks so much, Sarah. I can just feed into that last point as well, just appreciating that there are some folks involved in the Ideas Fund on the call. So I think it's not an exclusion, but I think given the wider context of what we're looking for to do with the co-priority setting, we will be looking particularly for groups that have not been involved necessarily in leading an Ideas Fund project. But that said, many of you are involved in projects with the Ideas Fund that might involve peer researchers, where they might actually want to take a bit more of a leading role in this type of work. It's not a pure exclusion, but it's just something that we want to be upfront about in terms of the balance, in terms of appreciating that obviously there has been support, but it's just something that we want to have the opportunity to have other groups to be able to support it to do this type of work as well.
So before going into the actual practicalities of what this working group will look like, I thought we'd just give a kind of recap of what the intended outcomes are for the co-priority survey as a whole and for this working group as well. So as we've been hearing from Sarah Ann and from Lewis, the idea is to kind of develop a richer understanding about what the priorities are for people across the Highlands and Islands, specifically around mental health well-being, but also about how researchers and communities can work better together to support better mental health and well-being. And so, as we've heard, this will partly inform our own Community Knowledge Matters network and kind of the development of the programme that we're taking. But as Sarah Ann was saying, it's also hopefully going to be able to inform wider policy around rural mental health, both in Scotland, across the Highlands and Islands in particular, but also, potentially within this kind of wider international lens as well. Just a wee point about the data and how that will be used. So because we're working closely with the University of the Highlands and Islands, the raw data itself, so the actual answers from the survey, will be stored by the UHI's own secure survey software, and then it will be anonymised. And after it's been anonymised, we will then make sure that it's made publicly available for wider use. So kind of an open source set of data that then any of yourselves or anyone who's kind of wanting to work in this field will have access to and be able to use for their own benefits, as well as kind of for addressing wider policy change as well. So that's kind of the general outcomes of the survey in particular. But in terms of the kind of outcomes for this working group, it's also, I think, an opportunity, especially for us within the Community Knowledge Matters network, to think of it as a kind of reflective learning experience, both in terms of co-producing and co-analysing a survey such as this, but also in particular how we can kind of work within an ethics process that is quite rigid in many ways in terms of the university ethics process, but how within this kind of co-produced kind of way and co-working together, how we can push that in any ways, how we can kind of do that work differently, even within the slightly more kind of structured setting of a university ethics process. So in terms of kind of our outcomes as a working group and also within our wider network, we're hoping that this can at least be a kind of a learning experience for us, but also hopefully for everyone involved in the working group as well. So yeah, in terms of kind of what this will look like in terms of involvement on the working group, the kind of involvement will include both shaping the questions for the survey itself, but also as we've kind of hinted at, we're keen for people to be involved in helping shape the ethics process of how we conduct this survey and how we all work together as kind of co-peer researchers. And so that because we're collaborating with the University of the Highlands and Islands, the ethics process will itself kind of sit into the university ethics process. And for that we need to put in an ethics application by the 9th of January. So we're kind of working with the existing deadlines and timelines for the university ethics process. And so that kind of explains a little bit about the structure and the kind of overarching schedule that we've got lined up here. And then after, people will be involved in helping work out how we can distribute the survey, but also after the survey has closed and we'll be collecting answers, we'll also be keen to have your involvement in in helping understand them, in helping kind of analyze the answers and think about how we can kind of make sense of this data more widely. As Sarah Ann said, there will also be an opportunity to collaborate on this international position paper, and working group members will very much be kind of acknowledged as co-authors in this process as well. So that's just to kind of give a flavor of the different types of activities. And again, we can go into a bit more detail with that as well. But that's just to kind of foreground why the timeline looks a bit like this. And in reality, there'll be a few more meetings between now and January just to meet that deadline. And then the meetings will kind of be a bit more spread out. So in total, we're anticipating it will be around 8 to 10 meetings, each one being around 2 hours long. And with potentially about the same amount of time of preparation in between. That might involve things like reading over kind of a text of something, maybe answering a few emails. And so the kind of schedule is that because of this short deadline for the ethics application, we are hoping to start the working group as soon as possible. And so we've got this short application form that will go into detail a little bit later. And so the deadline for expressing your interest in joining the working group is on this coming Tuesday at 5 o'clock, if that's possible. And then we'll make a quick decision. Again, we'll talk a little bit about the decision-making process, but you would hopefully know if you're in the working group on the 30th of November, so that we can have our first meeting all together as a working group in that first week of December. So we've got a few dates outlined already, and that would be part of the application process, would be indicating which of those dates you could manage. We'd then hope to have a second meeting in mid-December at some point, according to availability, and then meet again just before the ethics application is due in January. So our third meeting would be on the 8th of January, very specifically, because the deadline for the UHI ethics process is on the 9th of January. We would then hope to hear back about the ethics process around March. And so we would then at that point hope to have the kind of confirmation that we can launch the survey in March. We would have it open for about a month and would then close it in May, and then have another couple of meetings to kind of understand the results and think about how we can analyze them. And then finally, we would have another meeting around the time of this international conference that Sarah Ann was mentioning, thinking about how we can perhaps present those results for that very purpose, as well as thinking about how it can fit into our own wider aims with the research. And so there will be an opportunity for those co-writing sessions that we mentioned after that in July, most likely. I'll let you come in there, Lewis.
Just two quick additions. One is just to note that most of this is going to be online, but just there's the kind of logistics of that, but we are hoping that obviously if there's something that working would like to, that we may be able to at least have certainly the data analysis session in person, depending, and again, if appreciating that might be a little bit easier, so that would potentially be one in one of the ones in May, for example. But again, that's obviously subject to whether or not that's what the working group would like. But there is hopefully resource to be able to bring everyone together, at least in person, kind of later in the year through the process. And the second thing to highlight, and this probably is quite important, is that whilst, of course, this has been really led by the working group, that's the entire point, and being led by lived experience and people from Highlands Islands, there are interaction points with the rest of the network as well. So just to kind of say that, I think this is probably in the ethos of the work that we generally is that, there'll be other community practices with the Community Knowledge Matters network, for example, with the Ideas Fund network, to be able to feed in some ways to some of this work as well, in a kind of more general sense as well. So that's not to undermine the authority of the working group, as it were, but I think getting more viewpoints and perspectives on wording and things like that as well. There'll be opportunities to do that, and for us, that's within the spirit of kind of transparency and also getting more voices in to think about wording, for example, and help thinking. So there's always going to be a bit of a balance point around pace and keeping moving this forward, but also there will be other touch points as well. So I suppose in some ways, hopefully that gives you a bit of reassurance that there's a wider support network and there are wider voices across Highlands and Islands. You don't have to feel that you have to be representative of everything. through that process, because as we know, that is not possible.
Great, thanks, Lewis. Yeah, really important point. So in terms of kind of accessibility in the group, as we mentioned, we're kind of wanting to have as kind of wide a diverse group of people as possible, and especially really hoping to hear from people who haven't been involved in this kind of thing before and are coming more from that kind of community, grassroots community experience, or from their own lived experience. And so if you're wanting to be involved in this and you are not able to do so as part of your existing job, that is, if you don't have a job that is salaried and can give you time to participate in this working group, then there is a kind of payment, an honorarium that would be available for this work based on the amount of £75 per meeting. And that includes the preparation time. And this, we're kind of taking advice where, that this is based on the recommendations from the National Institute of Health and Care Research Standards for around this kind of level of involvement. But we're also really aware that it's not necessarily just about money and the kind of payment around that, but also if there's any other support needs that people might have, whether that's arranging for kind of childcare cover, that's a cost that could be provided outside of that, whether it's respite care and perhaps language interpretation, signing, other formats, whatever a kind of accessibility point would be, and that we can do to support that participation. If it's sometimes a little bit confusing about whether you would kind of qualify for having that honorarium. So if there's any questions, then we're definitely happy to discuss what that would look like in practice. Also mindful that some kind of universal credit, or it can sometimes kind of be a little bit tricky with other benefits or other issues as well. So very much happy to chat about that. I think next slide. Thanks, Lewis. So as I mentioned, we have a very short application form. So it's just on a Google form, and you can kind of see all the questions as they are. I've taken a screenshot of them just to run over what they are. And it's not a formal process. We're not looking for a certain number of words. It's really just to get a sense of who you are, what your kind of interest is, and how you might be keen to get involved. So you'll see some of those questions there, thinking about what kind of communities you belong to, and we're very aware that this can be interpreted in different ways, and whether it's geographic, whether it's a kind of community of identity, a community of experience, and so whatever you feel would be a useful way to kind of give some sense of your own background and experience, then let us know. And again, that point that we're not wanting you to kind of represent an entire community, but just have some of your experience and insight. And then if you have experience of doing this kind of work or working with a researcher, and just to be clear, we're not necessarily needing you to have that experience, and we're certainly hoping to prioritize those who haven't had any of this experience before. So yeah, the next slide. Thanks, Lewis. And so then again, just what you're interested in working in this working group and being part of the survey shaping process is. And then just a few specific questions around your kind of actual availability. As we mentioned about the timeline, it's a little bit structured by the existing requirements for the university ethics process. And so it is important that we will be able to meet all together within the required times. And then there's a specific question as well on the next slide about that first meeting, just because it's, we're hoping that we can all meet together quite soon. So you'll see it's very brief. There is a chance to kind of give any other comments at the end as well. And in terms of the selection process, we are looking for 4 community members to join the working group. They will sit alongside one of our steering group members, who's likely to be Caroline, who's in this call already, and also a young person, so Shannon, who's on this call as well, and also myself and Lewis as the kind of network coordinators for Community Knowledge Matters, and of course Sarah Ann as well, kind of co-facilitating this working group. So in terms of the selection process, we will be making the decision with an independent community organisation, just to kind of ensure a level of transparency. And really our selection process is going to be based on trying to have a diverse group as possible, both in terms of whether it's geographic spread, but also different levels of experience, different kind of perspectives that may be coming into it. And so if we aren't able to kind of achieve that diversity, there's a chance that we may continue that kind of application process just to make sure we're getting enough voices in. But yeah, that's the kind of rationale for our decision-making process. So thanks very much to those who've come along today, and also to those who may be watching in their own time. We will be sure to share around the Padlet link again, so that if you do have any other questions that maybe weren't answered in this short presentation today, or indeed you might think of some at a different point, do feel free to pop them onto the Padlet, and we'll be sure to check over it and respond. And especially if it's easier to kind of ask those questions anonymously. With the Padlet, it is anonymous by default, unless you already have a Padlet account. Do feel free to get in touch with us on the email address there, and that's my own email, lauren@sciencecayley.com. And I'd either be happy to arrange another wee chat if that'd be useful to speak in person, or if you have any other specific questions. But if in doubt, it should hopefully be quite a straightforward application process. The details are on our website, and I'll be sure to share the link for that as well afterwards. But yeah, just wanted to say thanks very much for your interest, and even if you don't have the opportunity to join us on this working group at this moment, there will, of course, as Lewis mentioned, be other opportunities to get involved in the general development of this co-priority survey through our communities of practice and other points of contact throughout the network. All right, thanks very much.